There is a crisis in our healthcare system, and it may not be the one that you think it is. Welcome to Mindfulness Voyage. My name is Ted Meissner, and in this and the next episode of this podcast, we will be exploring how mindfulness can help nurses experiencing burnout. Our guest today is Maryanna Klatt. Maryanna, welcome to the podcast. I'm so glad to meet you.
Thank you, Ted. Happy to be here.
And this was very exciting to me when I saw this research that you've done cross my desk, because it was combining two things that I am hip deep in as well, which is mindfulness and burnout. So before we get into that, maybe you could just say a little bit about your background, who you are and what you do.
Sure. Thank you. So I am the director of the Ohio State University Center for Integrative Health, which is part of the Department of Family and Community Medicine in the College of Medicine. I've been director for about 4 years, but I was intimately involved in starting the center 20 years ago. So this is our 20th year anniversary. Yeah. And so our focus is using all modalities that are evidence-based. The current research in all the things that used to be considered complementary and alternative are now evidence-based, which is great, largely due to the functional MRI and different biomarkers that we can use. I'm also a professor in the Department of Family and Community Medicine, and my true love is teaching. In 2004, I developed a program. I was trained at University of Massachusetts also in both mindfulness-based stress reduction, and then I'm a 500-hour yoga therapist. So in 2004, I brought those two things together to increase the amount of yoga that was typically done in MBSR. And my whole agenda has been to research, I'm a researcher, to research if a shorter mindfulness-based intervention could garner the same results as the true MBSR protocol if I added relaxing music and more movement and did it in an hour. We are now down to a half hour during healthcare professionals' workday.
That is just wonderful. And there's so many layers to what you said. And a few things stood out for me, which were incredibly encouraging. And I'll say that the number one of those, getting right to the chase on it, was that it's evidence-based. Mm-hmm. As I often say, science-based. And you made a very important distinguishing characteristic that much of what we do in mindfulness is that we've been bucketed into alternative medicine. Mm-hmm. As I said just last week earlier this week on a different post, if alternative medicine works, there's science behind it, we call it medicine. It's not alternative anymore. And this is one of the struggles that we have with mindfulness and yoga and other movement practices, Tai Chi as well, is that there is good, solid science with control groups showing efficacy, showing changes to the brain functionality. And yet insurance companies are still booking it into alternative and not reimbursing for so many different kinds of interventions like MBSR, MBCT, and the rest.
Right.
So we're working on it. Thank you so much for that. And also just sharing that there is research.
Oh, definitely.
And what I'm seeing, and I'm curious from you about this paper, and maybe we can dig into that a little bit, is that there's about 40 years of research on mindfulness, also about 40 years of research on burnout. Mm-hmm. And so I would love to hear from you about what was this new paper? How did it come about that you wanted to do this kind of intervention and do some research on it?
So I've been doing the same intervention since 2004. So the intervention has not changed. We've done about 1,600 healthcare professionals here at Ohio State. It has been paid for by the medical center since 2017. In 2010, I did a study, a randomized control trial in the surgical intensive care unit with 34 nurses. And we did salivary alpha amylase, which is a marker of sympathetic nervous system activation. The thing is, in the intensive care unit, very stressful for the healthcare providers, especially the nurses. So the stress was not going to change. But what I wanted to see was there a way to change their response to the stress that they were being submitted to on a daily basis? And we ended up getting a 40% reduction in salivary alpha amylase from the beginning of the 8 weeks to the end. So the hospital, when they read that paper, they were all, it's sort of what is a game changer, because there was a biometric now that was associated with doing the mindfulness. Fast forward, we had a R21 from the NIH a couple years later and showed differences in inflammation, so CRP levels, with people that were overweight but not obese. And again, that was a randomized controlled trial. So we've done plenty of work in this space. So to this day, it is sponsored during the workday for any employee of the medical center system. So it can be a janitor, it can be a nurse, it can be a physician. The two biggest groups now are people behind the scenes, physicians and nurses. But until this paper, we had never taken out the different healthcare professionals and to look and see if there was a difference between who benefited more. I honestly, I was invited to write this paper, and probably wouldn't have looked at the nurses separately, but I'm glad I did, because what we realized was, compared to, at the point we did this study, there were 630 people that we had total pre and post data sets on. And there were 128 nurses that were part of that 631. And they got a 10% greater reduction in burnout than all the others. And so that was curious to me. I was thrilled to see that. But so typically we get a 26% reduction in burnout from week 1 to week 8 on the Maslach scale. But for nurses, it was 36. And so that told me we are on to something here for nurses, and how important this is to do during their work shift, not an add-on.
Yeah, absolutely. And this is, again, one of the layers that I want to unpack with you, and maybe even pausing for a moment just to talk a little bit about what burnout is, because as I'm sure you have run into, there may be some misperceptions about burnout as being just one thing. It's just the exhaustion.
It looks different
dimensions
ways
as well. And I was glad to see you using the Maslach burnout inventory on this. I've used that in my program as well. Maybe you could say a little bit about the dimensions of burnout. And
sure,
explain that, and then we can go into some of the other things too.
First of all, early in my career, I about got burned out hearing about burnout. I thought that they were asking the wrong questions. Rather than asking, why is someone burned out? They need to ask, how can we keep people resilient? And so that really has been the thrust of my work. Emotional exhaustion is one of the biggest drivers of burnout for people. And even emotional exhaustion is displayed in different ways. The other thing is personal accomplishment. So if somebody feels a sense of personal accomplishment, even if their work is very taxing on them, that makes up for it. And then depersonalization. People start to feel just this big weight of I can't make a difference. And most people that go into healthcare do it for positive, empathetic, great reasons. And then when they feel like they can't make a difference, it just beats people down. And I think that that's probably those are the three factors that are part of Maslow and the three individual scales that we look at.
Yeah, and it's interesting that some of the outcomes of that going on unchecked is that people who are very dedicated and passionate about providing care for others lose that piece. They lose what brought them to, and in particular, nursing.
Yeah,
in the first place.
I agree.
And of course, this is a factor, as you know very well, the World Health Organization has added burnout to its ICD-11, its definition of diseases. And of course, the very next day had to issue a clarification. They didn't mean it was a disease, but a workplace phenomenon based on workplace stressors that are not being appropriately managed. So there's the conditions causing it. That's a factor. And I'm curious what you mentioned, that there was a greater impact on nursing staff. I've also seen this in my program too, that other roles were maybe not as influenced, shall we say, by the programs in place. And I'm wondering what some of your thoughts are on why that may be, whether or not we have research on it yet or not, or conjecture. Just what are some of your thoughts and insights on what that might be?
One of the things that I think is the skill acquisition. It's like they know what they want. They want to feel more engaged, more valued. But how do you do that? What are some of the mindsets that can help you see your value even more? We added a mobile app to our intervention, so people have the mobile app during the whole 8 weeks. They get a 2 to 5 minute video every day. I think that has been a game changer because they do not have to open their computer to go to the password protected site and, do all that stuff. It's just right in their hand. It's between rooms. It's mindfulness on the go, but then the weekly meeting to have the community building with others, people that are in your same situation. Actually, when I started, when the med center was considering paying for this, we started with physicians only. And it was the physicians that said, we need everybody in the room. Everybody's stress impacts each other. And so to just have us as a certain group doesn't make sense. So I personally think that some of the great decreases in nurse burnout is feeling heard in the group so that they can express their feelings and have them heard by other people, physicians, PCAs, whoever, billing specialists, what are the things that they are facing? And just to be able to air that with other people that work at the medical center, I think can be a fabulous thing.
Yeah, it is. And this is one of the elements that makes a really solid program, is that it can't just be in isolation, that it is
right.
A work group. It is an ecosystem.
It's an ecosystem.
And you can't just treat one part of it. You need to address all parts of it. So a big congratulations to the physicians on making that an important part of this. And
yes. Yeah, I felt good about that too. And then we have a train the facilitator program. So that's the cool part. So we deliver it. And if this program resonates with anybody within the program, then we train them. We've got a very structured training program. And then they deliver the program within. In fact, we're even delivering in your neck of the woods, Ted, up in Leahy Clinic. Yeah.
Awesome.
So we've got a 2-year contract with them.
You also mentioned something about, and this touches on accessibility to it, that this is done via app for their practices, say during the week.
Individual.
The individual practices. This is also something I did in my program. And then the importance of that community building for the sessions where people come together and have that connection and can be with others who are having the same kinds of experiences, understanding that your individual mileage may vary and what you're running into may be unique. What you also mentioned was that there was commitment for nurses to do this during the workday.
Yeah.
This is one of
I find that to be
pivotal
essential
things. It's huge. Otherwise, it's just one more darn thing added to an overflowing plate. What's some of the feedback that you've had on nurses, other professionals feeling supported by the organization by offering it that way?
I feel that's honestly one of the critical features and why we get such good results. Because if they feel supported by their work, like my workplace cares about my well-being, that's an intervention of itself. So we offer 7 different sessions per week. So that's the other thing, morning, noon, evening. And so if somebody misses the session that they typically go to, they can just go to any of the other 7 and they know when all those are. And I think that's also been a really good feature. That's something that we added so that, people just, if they had a doctor's appointment when they typically would go, they didn't miss the whole week.
Yeah, same thing. In my program is offering it at 2 different days, and you pick each week. If Tuesday doesn't work for you one day, it's fine. Come on Thursday, and if you're regular Thursday, come on. That's okay as well.
Yeah.
Well, amazing synchronicity, and of course, things based on evidence and research would tend to have very similar structures to them, and that's just validating that research and science works. What do you know?
The other thing that we did was I wanted to make sure that the program was sustainable past the 8 weeks. So right before COVID hit in 2020, I finished, thank goodness, a week before everything shut down, a sustainability study. I wanted to see how long did the participants maintain statistically significant gains after the 8 weeks. And it was 14 months post the 8 weeks. So that also I felt good about, because then I thought the return on investment was good for the med center.
Yeah. And maybe even longer.
Yeah, but that's when we stopped.
Ended at that point.
That was the average of all the participants that were out that did the study, and we had a good response rate. So I felt very good about that part.
So I'm wondering, what are some things that you would like to see in terms of how at least our culture in the United States approaches burnout for healthcare workers?
I think implementing strategies for prevention in onboarding is the key. And I think that should be part of, in nursing, typically it's the 8 weeks of onboarding, and to be part and parcel of that, so that they know from the very start, my organization cares about me. They are providing me the skill set to utilize, and I can utilize this moving forward and even have a mobile app to continue that practice.
Yeah, completely agree. And it's so important for people who are listening here to understand that being burned out is a response to conditions. It's not a failure. And stuck. And you can build your resiliency as well as work towards clearly seeing ways to creatively affect those conditions that are causing it in the first place.
The other thing that I think people gain something from is knowing that people that identify with their jobs, like in terms of empathy or, how I treat patients, is very important to me. they are the ones that are often the more likely to get burned out because of that self-identification with their professional role. And so just to hear that, I think is a burden relief from some people. I'm not failing. I'm not doing something wrong. It's because I do care so much that I'm more susceptible.
Yeah, exactly. And this is, again, can be a moment of insight about, oh, this can actually be something that is nourishing to me,
Mm.
that it's not so much uh, compassion fatigue, empathy fatigue,
Mm.
yeah, taking on distress, but being able to help others.
Mm.
So it brought you to this in the first place. So our guest today, Maryanna Klatt, thank you so much for being here. And
Thank you
as
for having me.
always, I'm going to have links to the research we've been talking about and a few other things as well. Maryanna, thank you so much for being here today.
Thank you, Ted, for the invitation. Have a great day.
Thank you so much for tuning in, everybody. It's good to have you here. And if you did get something out of today's episode, be sure to like and subscribe, and maybe even send this to someone else who may be in need of hearing this. Remember, every moment you have a choice. Make it the best you can, and I'll see you again soon on Mindfulness Voyage.